Hi, my name is Emily Vaughn, and this is my video for health assessment, and I will be doing my head-to-toe assessment on my patient here. So I have performed hand hygiene, provided privacy to the patient, and I will now be just assessing my patient's orientation and looking at her appearance. So, hello.
Hi,
What are you here for today?
I'm here to help you with your health assessment video.
Great. Are you in any pain right now?
No.
Okay. I'm noticing her appearance. She has clothes on that are appropriate for the weather. She doesn't have any body odor, and her personal hygiene is well kept. So if you wouldn't mind just to stand up for me and sit back down. Great, thank you. So that was just testing her range of motion and ability to follow direction. So following that, I'm noticing her skin color and appearance with that. She seems pink, warm, and dry. So just feel here. She's pink, warm, and dry. Noticing her nutritional status, her appearance, and everything seems to be well. So I'm looking here during our conversation. She's holding eye contact with me. She's alert and oriented ×4. I'll next move on to your head. I'm just going to be working my way down and through your body, so I'll just start at the top. So I'm going to be assessing her scalp here, trying to feel for any lumps or masses or pain. She doesn't have anything. So I'm going to move down here. Can you open your mouth for me? Okay, close it for me. And that's the TMJ, and I didn't feel any popping, so that's within normal limits. And I'm looking at the facial symmetry. Her eyes are equal bilaterally. Her nose is midline. She has a smile that's even. So I'll just feel here for the temporal artery. And I feel it pulsating on both sides. And I'll go ahead and just palpate here at your sinuses too. Do you feel any pain?
No.
Feel any pain?
Nope.
Great. Okay. Next, I'll move on into her eyes. So I have my equipment here. Okay. Just going to look right into your eyes. Look right at me. Okay. All right. That's great. So look at the light, and then look behind me, and look at the light again. So her eyes are perla. They're adapting to the light. They're equal and reactive. So I'll go ahead and move down. I'm going to just look up, or open your mouth for me. Noticing the tongue is pink and moist. The sides inside her cheek are intact and moist. Can you lift up your tongue for me? Good, and pull it down for me. I'm looking at her tonsils also and the uvula, grading them as well. I'll go ahead and look up her nose. They're clean, moist. I see the no deviated septum, and the turbinates are visible. Great, thank you. So now, from there, I'll go ahead and have you do I would do the Snellen test with her, so I'd have her stand 6 feet away from the Snellen chart and read the furthest line that she could. That would test her visual acuity. So if you want to go ahead and just cover one eye for me, and you would read it like that, and then do the other one and read it like that. Perfect. So next I'm going to do the 6 cardinal directions. If you could just look at my hands, look down, do it again, look down, side to side. Great, she did that well. Then I would be testing her peripheral vision. Go ahead and tell me when you can see my fingers.
Can see them.
Okay, I'll come around here to the other side. Tell me when you can see my fingers.
Can see them.
Okay, great. So that was testing her peripheral vision. Next, I'll move to the ears. So I would change my material so I would have the scope present so I could see further down into her ear. But just using what I can see here, it looks like her ears are dry, they feel warm. Do you have any pain?
Nope.
Okay, great. Move over here to the other side, looking down into them. I would be seeing the tympanic membrane, seeing that it would be a pearly, shiny, white color. Any pain?
Nope.
There? Okay, so her ears are symmetrical. I was able to view the ear canal and the external structures. Also noticing the external structures of her eyes while I was doing that assessment as well. So I'll go ahead and move down onto the neck. So I'm just going to first be inspecting it. I don't see any lumps or masses. The skin is intact. I'll just go ahead and palpate here for the lymph nodes. I don't feel them, which is good. All right, can you move your neck side to side for me? Do you have any pain?
No.
Okay, can you lift your shoulders up and down for me? Great, so that would be testing for muscle strength in her shoulders. So I'm going to go ahead and feel the carotid pulse, each side separately. Feel out there. Feel it there. So they are strong and equal bilaterally. I will then move down into the chest, where I would first just inspect for expansion. Take a big deep breath for me. Let it out. Does that hurt at all? Do you feel any pain?
No.
Great. Okay. So then I will go ahead and listen to heart and lung sounds. Oh, and then I'll go ahead and do that now. So I'll be listening to the 4 valves in the heart. Over here would be the aortic valve, the pulmonic valve, the tricuspid valve, and then the mitral valve. I'll be counting there for a full minute for the apical pulse. Before I move any further, I'm going to go ahead and just finish up with the neck. I'd be inspecting her trachea for any deviation, and it's at the midline. Also palpating here, her thyroid. Do you have any pain there?
No.
Okay. So that's great. Now I'll move on and do my lung assessment. I'll first start with the tactile fremitus, and that would be, I'll just have you say the phrase 99, and I'll feel the vibrations here. So go ahead.
99.
Okay.
99.
Okay.
99. 99.
Okay. I was able to feel the vibration on the outside of my hands. So that was good. I'll go ahead and just feel for any masses or pain, anything there. No lumps or tenderness. Next, I'll have you go ahead, and whenever I touch the stethoscope to you, just take a deep breath for me, okay? I'll be listening to the lung sounds. So I'll be doing in the 2nd intercostal space on each side, the 4th intercostal space, and the 5th intercostal space as well. All right, her lung sounds were clear bilaterally. So I would then go around the back side and listen as well. I'd listen up here to T1 and T1, then move down to T3 and T3, and then T9 and T9, and then further out at the midline, T9 and T9. So now that I'm done with my heart and lung assessment, I'll go ahead and move down into your arms. So I'm just going to feel the radial pulse here. Radial pulse here. Great. Can you squeeze for me? Good. Can you move your wrists? Great. So that's testing for range of motion. Can you just bend your hands? Great. I'll go ahead and test the range of motion in your shoulders. So just move your arms for me, both sides. That's great. Do you have any pain? Okay. So her upper extremities look great. They're pink, warm, and dry. She has full range of motion with no pain. So now I'm going to just move further down your body. If you wouldn't mind to lay for me, I'll go ahead and move on to the stomach. So I would first be assessing the shape of her stomach and the color. I'm noticing that it's rounded and equal. She doesn't have any masses or anything like that. So I'll go ahead and listen in all 4 quadrants for bowel sounds. So her bowel sounds are active and audible in all quadrants. So I'm going to go ahead and just palpate here. Do you have any tenderness? Any pain? Okay, it was warm and dry. She doesn't have any tenderness or pain. And I'm watching for any pulsation descending from the aorta. And I do see one above, so I'll listen. All right, and I can hear vascular sounds within the abdomen. So I would move on into the deep palpation of the liver and spleen. So I would feel here for the liver border, she has any pain or tenderness, and the spleen is over here on the left side, any pain or tenderness. I would then do the scratch test of the liver, placing my stethoscope and scratching for the liver border. And they are within normal proximity. So that concludes the abdominal assessment. All right, you can pull your shirt down, thank you. I'd then move on to her lower extremities, so her legs. I would notice here, the shape of her legs, they're normal, they're symmetrical. I would be noticing the color. They are pink, warm, and dry. And then it says pulses in her feet. And they are both +2. Alright, then I would test the range of motion within her lower extremities. If you could each leg lift, and so you can bend your hip. Perfect. Same thing. Great. And then just bend your knee. Okay. And then bend your other knee. Great. Thank you. All right. So did you have any pain with that?
No.
Okay. Great. So she has active range of motion within her lower extremities. So if you would go ahead and just sit back up for me, please. All right. If you could go ahead and stand up and then bend down and touch your toes. Perfect. And then if you want to step forward a little bit and then do a deep knee bend just to see. There you go. Perfect. Thank you. Do you have any pain with that?
Nope.
All right. If you could go ahead and just walk to the curtain and walk back. I'm just assessing your gait. Great. She has a steady, even gait. Alrighty. And then stay standing and just turn that way and bend over and touch your toes. I'd be looking for any scoliosis. I'm going to just pull your shirt up a little bit. So her spine is even. It's not curving at any point. And all the way. Okay. And I'd be looking at her hips as well to see if there's any shift, and there isn't. And her shoulder blades are even. That's fine. Thank you. So if you could hold your arms out for me. Okay. That's for the Romberg test, and there's no shift, and she's able to follow commands. So that's good. And if you could go ahead and just take your heel of your left leg, your left foot, and then run it across the other side. Perfect. That's the heel toe, and she's able to do that. All right. And then if you could walk across to heel toe when you're walking. Okay. And then walk back on your tiptoes. Okay. So she is able to perform the range of motion and follow commands and the gait tests. So now I would be doing the reflexes. So I would be here for the brachioradialis reflex. I would hit here and watch for a reaction down here to pull up on bilateral extremities. Then I would move down and have her sit, and I would strike here below the kneecap on the patella and watch here for the reaction to kick out with her lower legs. And then I would move down into her ankles and the Achilles, where the Achilles tendon is, and would strike for a reflex in the Achilles tendon. So while you're sitting, if you wouldn't mind just to touch your fingers to your nose. Okay. All right, she's able to do that without difficulty. So she did that well. So this concludes my assessment for the health assessment class. So thank you very much.